Good evening, everyone. For those who are new in this room, my name is Tinda Dorji. I'm working as one of the physicians in CRRH, and I'm also one of the adjunct faculties at the university. I know that there are many people who are interested to start doing their own research, but sometimes you in the initial stages, there are many people who would require a lot of information to make the right decisions. I don't claim that I'm one of the master researchers, but I've done a couple of papers, so I've walked the path in a couple of papers, so I'll be able to provide you with some experience about the journey. So for this session, I have titled the session as Step Zero because and after when you have really started doing your paper, doing your research, then only you'll be able to know what step one feels like, what step two feels like, and what the final output, what a publication feels like. Today I'll be covering on why you should be doing research, and basically mainly to get how to help yourself get ready and how to begin. And once you have begun doing your research, then you'll know that you'll have a feel about it, and then sometimes you might like to go the long way, but sometimes you might be able to figure out some shortcuts as well. And once you have started a project, how to complete it is a very different task. So this can be discussed in some other session. So research, why do we have to do research? There are micro, meso, and macro reasons. Micro is at an individual level, someone you, for an individual person, you would like to have a publication in your name, you want to get promoted, or you want to have a better CV, but a CV, at an individual level. For at a meso level, at a medium level, it's more about showing how much your institution is doing research. For example, if you're a part of Gesargelpo University, how much is the university doing research? Or as a part of a teaching hospital in Gelepu, as a hospital, how many research have we done? Have we done big enough research, or is my hospital producing case reports, which means my hospital is managing those cases? And for macro reasons at a country level, the research output shows the knowledge level or the knowledge capacity in a country. If you do research, then it serves into many purposes. The one paper that you publish will serve you as well as your hospital or your institution and your country. So there is always a benefit at various levels. And as a person, many of us are now in the group. I see that some of us are clinicians, some of our students, some of us are teachers. But only when you have done your first paper, when you have got into your paper, Ugen Chaval cannot see the slide, Logan. Are others able to see the slide?
Yes, sir.
Okay, then maybe Ugen Chaval, maybe he's using a phone. In the desktop you should be able to see. Then once you have done you have started walking on the path of research, then you become a researcher. But not every researcher gets a paper published, because some do research and they never publish the papers. So once you start publishing your papers, then you will become an author. So you can be the first author, middle author, last author. After a couple of papers, then journals might invite you to become a reviewer, which means you are now climbing up the ladder of your academic skills, which means after a couple of papers, then the journal thinks that, oh, this individual is capable of reviewing or commenting on somebody else's research. So you'll become a reviewer. And after that, you might become an editor. Like I am an editor for Bhutan Floric Journal and Bhutan Health Journal. So when manuscripts are submitted to the journal, I can give an answer, or I can review the paper and give a decision as to whether, okay, this article fits for Bhutan Health Journal, should we accept it or should we reject it? And then you might also become a journal manager, which means you are a very senior editorial position. And then at this position, you are able to understand uh, what the manuscript stands for. And then this is, if you have reached a journal manager position, that means you are at a very high level in your academic position. Now, to do health research in Bhutan, it is a very exciting field. There's a lot of scope to do research in Bhutan. And who can do research? There is no academic criteria or no qualification criteria, no experience criteria to do research. So even if you're a student, If you're doing a very good research, you can go ahead. There are many research papers that are published by high school students in internationally acclaimed and reputed journal. So, so if you want to do it, there's no barrier to doing research. Just that you are a student, research paper. So even a student can do research, even a senior person can do research, and even at a very high senior administrators can also do research. So the topic or the type of topics that you handle, the type of papers that you are handling might be different, but anybody can do research. So when do you start doing a research? I'd say that you should start doing research from today. And to start, one of the first steps is to find out the research question, or you have to talk with yourself, take a step back, think, and then decide on which topic do you want to study on. Then that answer will come from your interest. What are you interested in? Now you have to think, and then next step is that everybody says in the beginning, oh, I can't do research because I don't have the skills. I have to go back to my school notes, or I have to read that lecture note. No, you don't have to do anything. So you can do it. You should start taking the step. And do you do it yourself? I think walking the research path alone will be a very lonely path. It will be very difficult, and you will need a lot of steps. So what I would recommend is you start thinking about a research question, select a topic, and you get yourself through, motivate yourself, and always work in team, because there's a lot of advantages. Because one, you can see from the subsequent slides. Now, in research question, what kind of research question do you take as a beginner? My advice is always to select a very simple topic. Why? Because it's easier for you. For somebody who is doing a PhD or somebody who is doing academic thesis, yes, you can go ahead and then do very complicated research, or you can do clinical trials. You can take up several research designs together. You can nest it. You can have very complicated research designs. But for a beginner, you go for when you go and pluck fruit. I always give this example. You begin with a low hanging fruit, something that is easy, something that is doable, because you have to take a step-by-step approach. The reason is that when it comes to types of manuscripts or types of articles that are published in journals, there are more than 400 different types. And then if you look, for example, if you are thinking in terms of your traditional thoughts that you should always publish research article, you should go to the field, collect data, and then, or you should go to the lab, measure something, and do research. That is an original article. Yes, that is the traditional type of research that we are exposed to. But there are so many other types of research articles. Now, if you are an expert, you can write a review article. If you think that you are doing a very short research, where you want to get the paper published in, or you want to get the project completed in a few months, it can be a short communication. If you are a clinician, you can write a case study. Or even if you're a policymaker or administrator, and then you into works. For example, how to really shorten the waiting queue in your hospital if you have found a different intervention. This can be a case study for a policy review. So you can write commentary, you can write meeting reports. For example, recently we had for traditional medicine, there was a big conference. So so a big conference. So for the conference, then you can summarize your conference proceeding and write it as a manuscript. So there are many research articles, many types of articles that you can publish, and my advice is to select something that is easy for you. So it is not always necessary to begin with a research original article. This is because many of us have seen this pyramid where you give the hierarchy of the articles, or hierarchy of the level of evidence. Here we have case series, case reports at a very bottom level. Then it goes to clinical control trials, comes somewhere in the middle, and you have systematic reviews in the top. Now, if you are climbing a mountain, or if you are climbing this pyramid, why don't you start with very a simple article? So I always say that you start with a case report, commentary, case report, because it is very easy. Now, There are many people who, without maybe they don't know where it sits in the hierarchy, but some would jump directly into RCTs, or some would want to do systematic reviews. Now, if you directly want to climb up to the top, it becomes very difficult. First of all, where it becomes very difficult for you to do the research and for you to complete the research. Second thing is it becomes very difficult for you to find a mentor, or if it is an academic thesis, it becomes very time consuming for the mentor to teach you everything at one go. So always start with small bites. This is my advice. So I would always say start with a commentary, letter to the editor, or perspectives or case reports. Then go on to observational studies. Then you can do clinical trials, and then you can climb onto systematic reviews. Because in your research career, everybody would like to progress, and then you want to show that you want to experience how it is to do a systematic review. The reason why I say this is because when you're writing a commentary or perspective case reports, here you are focusing only on writing, literature review, and organizing your ideas. See, there's no data analysis or data management involved. So statistics is very difficult. So you just don't have to, statistics is not involved in this commentary or any case reports. Now, if you want to learn data handling and statistics, then you will start going to do observational studies. This means that you will interview 300, 400 students, or you will interview your patients, or you can review the patient reports from your past 1 year hospital records, something like that, where you will have to collect data and handle the statistics, because this requires a lot of skills. Now, if you are doing clinical trials, then you will require a higher level of skills to handle data and higher level of statistics. Now, only if you are able to write your paper well, organize your thoughts well, if you are able to handle your basic statistics, then you will be easily able to do higher level statistics. And if you have all the skills of these three steps, then you can easily do systematic reviews, because you are, by this time you have all the basics to make and to really do a systematic review. This is my message. If you're climbing stairs, take one step at a time. If you see Bhutan Journal, so you can see that there are these are easy articles like commentary here. These two topics are commentary, where there's no statistics, you just sit, it's a desk job, you organize your idea and put it as a commentary. Then this is a case report where you are summarizing a patient case, and here there's no statistics, but this also helps you to organize your thought, how to present your data, and how to really communicate scientifically. And these are very easy to write, which means you don't need a lot of time. Of course, for your case report, I'll show you in the subsequent slides, there are certain, you require some time to get the approvals, but to really write a case report, it does not really take time, because you have all the materials in your hand. So in writing a commentary or a review, you just sit on your desk and you can get this paper published. Now, coming to original articles, see, if the articles are short, like this article is just the observational study description about the people who are coming to visit to take traditional medicine services. These are observational studies. These are very short, simple articles. So these are called as short communication. Now, this will also help you develop a lot of skills. So if you skills now, if you're going to a little higher observational study, then this can be an example. And then if you are at a very top level, then you can go for a randomized control trial like this. So, you should know where your paper stands and where your skills stand. So, as your as your skills improve, or as you pick up more skills, you can take a higher level of studies. Now comes next is, for writing all your papers, be it from simple to RCTs, you should know how to do literature review. And literature review requires several steps. First, you should know where to search for information, how to review the material or the literature that you find online, and how to synthesize the information. So here, there's this difference between the term literature search and literature review. Search is just you're looking for information. Either it can be a Google search or a very high PubMed search, or it can be looking through your reports. But after you have after you've got the literature, then you will have to synthesize or sort out your information. So literature this is where you will have to have certain critical appraisal skills, you will do your you'll have to organize your thoughts and information for any synthesized paper. Then you'll be able to take it to the next step, which means you'll be able to incorporate it into your proposal or your thesis document. Now, in the next step, you should identify when you find literature, you should know that the grades of how good your literature source is. Now, if it is from any peer-reviewed journal, now it means it is at a higher it has a higher uh, grading, or the quality is good. Which means if you have a choice between citing a report and citing a peer-reviewed journal, you should cite a peer-reviewed journal. Now, the trick will come in the next slide. Now, there are many gray literature. Now, even though if it is published by WHO or United Nations, or it is still a literature. Why? Because it is not peer reviewed, which means it has not gone through the scientific analysis. Okay, so you will be able to do the this is peer reviewed. However, in many of the however, when you're writing a manuscript, you will require so many local information for Bhutan. So the Ministry of Healthcare reports and all those hospital reports will serve as a very good source of information, but they're still classified as gray literature. Now, for example, here these are all very good sources of gray literature. The National Statistics Bureau will give you the national level data. Ministry of Health reports annually. This will give you the country level data. And for most of the hospital level information, you can get it from the JDWNRH annual report, or for Gallipo, we have our own report. For university, they have their own report. So when you are writing or when you're giving the initial description, this becomes very useful. Now, when you're going to look at online search, and when you're going for database search, there are many online databases that you can search. Most popular one, PubMed and Google Scholar, not Google search. It's a Google Scholar search. Now, if you want to search for clinical trials that are not even published yet, you can go to clinical trials website. Now, there's a catch here. Not every article published or available on Google search are citable, which means some of them are from poor quality. Some of them are from poor journals, which means you should know what is a predatory journal. Predatory journals are those that are not they do not publish valid scientific information. Now, here in Bhutan Health Journal, there is a very good editorial on how to identify a predatory journal, which means when you are searching for information online, you have got an article, and then now, before you really consume that article or before you recite that article, you have to do the litmus test. So based on these criteria, and then see whether that article is good enough for you to cite or not. So when you look into this framework, there are so many things that you have to look into it, which means that you'll have to make a judgment whether this article is good or bad before even you consider it citing in your research. Now, if you think that this is a very tedious job, or if you think that you might get the classification wrong or you're unable to identify, then the shortcut answer is just search PubMed. So whichever article that appears on the PubMed, you cite it. If the article does not appear on PubMed, or you have just found it on your ordinary Google search, don't cite it. So it becomes very easy. So in many instances, I just search only PubMed, because all articles that are there in the PubMed are quality assured, which means they have passed through this, they have passed the litmus test. Now, when you're doing Google PubMed search, it's now before the older version of PubMed, you needed to know what is medical subheading, and then you had to do your search very systematically. Now, PubMed has become very easy. You can do simple search like how you do Google search, but not like how many cases of rabies in Bhutan. No, you're giving a lot of words and you're missing out the keywords. So keyword search would be rabies, Bhutan. So this is now the PubMed has become very, very easy. Now, once you've got your literature, now you should save the PDF and save it into your referencing software. There are many referencing software where some of them you have to pay, some of them you can use a cracked version, but there is Mendeley, which where it is easy to use. It is a free software. Now it has two versions. Mendeley Desktop is the older version, where the company has said that they will no longer give updates, which means from here there will be no more new versions, but it still works, and then there's nothing wrong with it. There's a new version which is Mendeley Reference Manager. You can use either of this, and in both cases you will have to use Microsoft Word plugin, which means you have to install the software in your website, in your desktop or laptop, and then you use a Microsoft Word plugin in your Microsoft Word, and it becomes very, very easy. There's to use this software, there are just, you can watch a video for 3-minute video online, and then you can get it done. It's very easy. Now comes, you have done your research, you have searched for information, you have downloaded all the information, you have read it, and now how to really store the information. So how to organize yourself. This becomes very important because in the beginning, many people get lost, and then it becomes rather confusing. How I do, I organize it in folders, and then I'll show you example. Now, one is how to organize your folder. Second is how to organize your literature, which means, for example, if you decide that you will read 30 research articles for your case report, or you have downloaded 30 PDF, how to really store them, and then how to name your files. You can see this. So this is a recent case report that I have written. So I organize it this way. Approvals, approval from Ministry of Health, approval from hospital, all are stored. Consent from patient is stored here. Now I have submitted to ethics board. So all the files related to ethics board are stored here. So this is the literature review that I've done for this one. And then this is the manuscript that I've written. This folder contains the manuscript. So it becomes very organized. So you store all of these in a master folder. Now, when you open one of the folders, for example, when you open the manuscript file, I name the file as this very short name, and I name it as version 01234. So when I look into the file, I know that version 2.0 is the latest version. Now, if I need to share it with someone or submit anywhere, I know that this is the latest version, and then this is to avoid confusion. The reason why I keep short name is because if you write methotoxicity in a case report from CRRH, the file name becomes very long, and then at the end, it becomes very difficult to identify which one is your version number. So you keep very short name, and then here our version number 1, somebody called ST has given a comment. He has made edits on this, and then here, after this, I have made further edits. Now, how do I store my literature? So if you open this literature review, so literature kinalo, of course, this methotrexatoxicity was in a patient with rheumatoid arthritis. So I was referring to the American College of Rheumatology 2021 criteria. So here I've written as author and date because it arranges in alphabetical order. So it becomes very easy for me to find. So ACR 2021 rheumatoid arthritis criteria. Now here, this DEMA 2022, and then if you, for example, this was downloaded from Bhutan Health Journal. Now, if you download it, it will get stored in a very different file name, and then it will become very difficult for you to identify. So by looking at it, I know that it has a very short name. So it's about medication error in Bhutan, and then it's you can game, and then which one is a recent article, because sometimes DEMA might have given another might have published another research article in 2023. So name help you organize yourself. The next thing, version control. Now, how to avoid confusion. This is a guide that we use for our journal. Now, very short name, and then you will write as version number 1. And then without having sent to anyone else, you have made revisions, and then you have named it, you have copied the file, and then you store it as version number 2, because sometimes you'll have to go back here in version number 1. You might have put a diagram or a figure, then you have deleted it, and then if you have reached version 2, but you still want the old diagrams or bring it back. And after that, two has been shared with your friend, somebody named Don has given edits. So if your friends are using this any format, they might just write their short form or name and then send it back to you. Or they, for example, Don has replied the any file to the group email, and then somebody called Adri has made the edit here, and then see version number 2 nalu, first Don has seen, Adri has seen, and then they both have made their comments, and then here you have made revision, and then somebody else has made it edits in this sequence, and then if you see, it becomes very easy for you to organize and then see who has commented, who has made edits, because sometimes see junior co-authors would be working on the earlier versions, and maybe your senior professor might look only at version number 4. Why? Because professor knows that if he looks at version number 1, there will be many things for him to correct. So the professor says, okay, why don't you get it corrected among yourself? See? Now comes when you're doing research, you need to do it in a team, and then you need to identify authors. See, after you have, if you have completed a research paper, and then when you're trying to publish, if you're inviting new people, some might join in, but some might not join in on your paper. Why? Because they would not get an opportunity to influence anything, or they might have wanted to do the research in some other way, and then you have missed out many things. So many senior authors, like experienced researchers, do not like being invited for authorship at the end of the paper. Why? Because there's nothing, basically there's nothing to do. If the science was bad, if the paper was bad, if the statistical analysis had missed out a major thing, there's nothing you can do about it. So it's very boring. So experienced researchers would really like to join in right in the beginning. Why? Because in the beginning, you can influence the research objectives, research question, how many variables, samples, so they can make sure that they can give the right intervention at the right time. You'll have to fix your authorship right in the beginning. Of course, at the end you might add in others, but it's always better as soon as you are starting to draft your proposal, you start naming the authors. Now, how do you name the authors? How do you who all should you include? Because you should give due credit whoever who has contributed to the intellectual development of your research. Now, authorship should also be representative. I'll give you some examples. Now, for example, this is a case report of mine. It was on catastrophic antiphosphate syndrome. Radiological imaging. So there are infarcts here, there's pulmonary embolism, and then as a clinician, I make use, as an internal medicine physician, I make use of this CT scan. But am I an expert in this interpreting or representing this CT scan? No. And this is another case on paraganglioma. As a physician, I have diagnosed it, I have treated it. But this is a tissue diagnosis. So am I the right person to really interpret and explain, or will I be able to do justice in explaining this now? Basic components I can explain by looking at the diagram, yellow, these things, this is this, I can explain. But I feel that I do not really have the intellectual authority over such components of my own case report. So therefore, you should think, should a radiologist or a pathologist be included as a co-author? Yes. Why? Because your authorship should be representative. Now, in this day and time of age, no doctor can treat a patient on his own. For example, if I want to treat dengue fever, which is very simple, but I cannot treat it alone. I need the help of a lab. I need the help of the nurses. So if you're writing a case, if you're writing a scientific component, you should include somebody who represents the science that is contained in your paper. Now comes authorship key position. Now, who is, for example, this is a case report that was published, and here we are 3 authors. This is me, this is another author, second author, and the last author. See, usually the first author represents that you have done the majority of work in writing this case report, or you have done the majority of the work in this research project. And second author would mean that he has done the second maximum amount of work, and then third maximum, and it will go on. Who is the last author? Last author is someone who is a professor, and he is indeed my professor. He was the head of the medicine professor. So whoever stands at the end means that the guy on the end has the maximum knowledge. It is a professor, and he's at a supervisory role. It does not mean that the last author is the least important. Now, if you are a very junior, you will be usually in the first author. And then for me, personally, I have started as the first author, maybe as the second author, and now slowly, now people are pushing me toward the last author. Why? Because I'm trying to help and mentor young people. Now, all the recent case reports which were written by my young colleagues, hit me as the last author, which I'm okay, because in that small group of researchers, I was the one who was relatively more senior. Now, I hope that with this information, you will be able to start writing. And then how do you learn research? Only by doing and writing. So while doing, there are a few skills that I hope that everyone knows it, and then this can be demonstrated later. And in Microsoft Word, you should be able, you figure out and play with the features of Microsoft Word. There are certain features such as line number that because when you have line number, it becomes very clear for people to say that, okay, rather than saying first page, first paragraph, this word should be deleted, they can directly point out line number. So there's a feature where you can find a line number. Then you should know how to write page break, section break, because sometimes some tables are long on the horizontal side. So you would want only one page to appear horizontal. So you should know how to make it. Then page, how to number the page number, and sometimes you might require table of contents, but this is not required for now here. So here, line on your page, how to insert line number, you will go to page layout, and then you can do continuous line number, which means line number, first page number, it will start 1, 2, 3, 4, and on the second page, it will continue as 5, 6, 7, 8. Or for every page, you can start as first line could be restart. You can start it at number 1. There's another feature which is called a section break and page break. So you should know the difference between section break, page break, because sometimes you want the introduction to always start on the first line of the next page, but for the preceding page, there are some gaps. So you don't have to press enter to push that introduction word to the next page. So you use page break, right? Because this helps you organize. Now, if you're while writing your paper, if your Microsoft Word page is so messy, I don't think you have a clarity of thought, and that just because it's not organized, you will not. The other authors will end up getting distracted, or they will not be able to focus on the actual science. When you're making flowchart, I recommend to use go to page, go to insert, shape, and use canvas. Don't draw any diagram flowchart on free Microsoft Word, because when your friend or the co-author reads it on the Microsoft Word, it gets distorted. So write it on a canvas. How to write in English? I don't think I have to teach you, because everyone is we are educated in English. Be very clear and concise in your write-up, and it should not be ambiguous. If you mean it, you have to be very clear and specific about what you mean. So how to write I don't want to be a teacher here. Now, when you're writing, you should, even if you write a case report or a commentary, you should have the skills to cite the literature, you should organize your thoughts, and then you should write and rewrite. If you think that if you just write it, and then the moment you complete 1,500 words, if you think that this is the best version of the article, no, it is wrong. If you let somebody else read it, you will find that others will have a different perspective, and then what you have written will have a lot of limitations. So always write and rewrite. Only rewriting. How many times do you have to rewrite? Well, initial times, in my earlier days, I used to go up to version number 30. I had to revise it 30, 40 times. And then some of my co-authors, especially when they are starting out, if you, co-author, I would make them revise many times until it's very good. But if you're writing with a very senior author, somebody who is very knowledgeable, maybe to get off to a very good version in a lesser number of versions. And once you have written, you should always get it reviewed by others, your co-authors. And then scientific writing requires practice. And if you want to take some Coursera course, you can take this. It's a very good course on writing in sciences, how to write in do scientific writing. You can take it free of cost. Now, if you want a certificate, you will have to pay, but without paying, you will be able to complete the course. And it is a really good one. I've taken it. Now I'll give you some learning materials. From where can you get additional information? Because this is step 0. If you want to go to step 1 and forward, you will have to go. You can take these look at these online materials. One is called the SORTIT, Structured Operational Research Training. This is available in YouTube. It has 3 modules. If you watch all of them diligently and take notes during it, it will teach you everything about how to do an observational study. Now, this course in Bhutan, we call it Be Smart, that is being given to the postgraduate medicine students. In Coursera, there are many courses that will teach you basic research, basic write-up, basic statistics, how to do clinical trials, how to do systematic reviews. So there are many courses you should do. Now, if you think that in Coursera, many of the courses are given by the CHILIPs. If you want Indian material, because some of us our minds are tuned to the way the way it's being taught in India is little it's different. So some of you might like this national platform for technology enhanced learning. So there are 2 courses in this. Here, if you want to get certificate, you'll have to give an exam, but I think it's just okay to take all the teaching material and then not get a certificate. So there are many courses, just like very good ones. Now, in Bhutan, if there are opportunities for you to do Be Smart course, if the university or some agencies announcing courses for Be Smart, you should definitely take it. Now, coming towards the end of this session, you will never be able to start doing research if you don't think of yourself as one. You should now start identifying yourself as a researcher, and that you will be able to do research. Now, there are a couple of researcher IDs that you should be able to you should make. Which I would recommend. First one is ORCID, or you can pronounce it as ORCID. ORCID is a 16-digit researcher ID, and then you will go to this. You can go to this website and then get yourself registered, and then as and when you have your papers coming out, you can register with it will get deposited to ORCID. The second one is ResearchGate. It is a very good platform that will give you access to your research articles. It will map out how many research you have published. The third account that you should have is Google Scholar. You should go to Google Scholar, make an account, and then start depositing your document. For example, see, this is Google Scholar of one of our colleagues from Bhutan, and he's the highest cited authors. The number of papers, see, look at the citations here. From all the manuscripts or all the papers he has cited, some of them are cited 330. Maybe the number might have increased definitely, because this screenshot was taken long before. And then for total, his paper has been cited by others 1154 times. So this means that he's a very very influential researcher. And then if you think that, I'd always give you advice to make a very professional looking email ID. If you have a very childish looking, or if you have a very funny email ID with, like, if you think that some other others might find your email ID funny, this is the time you should make a very professional looking email ID and something that is intuitive. For example, if I meet someone and then I'm unable to give him my card, and then he forgets I'm unable to my email ID Jimasubajin, then okay, his name is Chinle Dorji. So if he just types Dr. Chinle Dorji, he should be able to reach out to me. So it should be that intuitive and that easy. Not like T or G numbers, so many 5, 6, 7 digits of number. Why? Because nobody will be able to remember the number. And when people are trying to contact you, and if they make a mistake in one of the digits, then they'll not be able to reach out to you. So these are some of the, if you start making this research profile, you will feel that, oh, you're a researcher, and then you should, even without any paper, even if you don't have any paper, you start making this researcher accounts, so that, okay, you feel that the template is empty, so you will populate it with your publications in the future. Okay. Now coming to the end, to really walk the path, there are few in Bhutan. How do you really want to go about it? See, if you want to write a case report, it's very easy. You get consent from the patient, and while you are managing case in the hospital, you know, if you think that, okay, this can be a case report, there's something unique about it, there's something different about it, I want to publish this as a case report. Or if you're unable to decide, reach out to any one of your young specialists. They'll be more than willing to give you advice. Oh, this is a very unique case, you should write a case report. So you can, after, because taking consent from the patient is very easy if you take consent while the patient is there in the hospital, because by that time you have made the decision that you will have to publish. Then the second step, you draft your case report, you get clearance from your hospital, you get clearance from Minister of Health. So for this, you'll have to write your right email, and then you should get ethics approval or ethics waiver from those. If your study site is in the teaching hospitals, Thimphu Gelifu Mongar, your ethics board becomes the IRB, Institutional Review Board, Gesargetu University. For everyone else, or if your study site is in the community, for example, I'm in Gelifu, but if I want to go and interview school students, or I want to go to community like Chuzargang and interview people, then my study site is outside the hospital. So my ethics board becomes Research Ethics Board of Health, Ministry of Health now. So there are two. For both, you will have to submit now. You'll have to submit your protocol through the Bhutan Health Research Portal. For REBH Ministry of Health, the portal is active and functioning. For IRB, it is yet to get functional, but I think it'll be functional soon. And then after that, you submit to the journal and then respond to the journal. Now, for research articles, it's a slightly longer step. So you have to, in your protocol, it takes, there will be, the protocol itself has so many components. So you will have protocol, you'll have the information. If you are interviewing, you'll have to give information sheet, consent form. Now these two have to be in English and Zonka. First, you finalize everything in English and then make it to Zonka. You have to have a data collection form, and then you have to finalize whether you want to do a paper-based collection, online-based collection, you want to use Google Form or Epic Collect, so many things. Then the others are same. Site clearance from your hospital, or if you're going to a school, school principal approval or district education officer approval, you'll have to get your administrative approval from Ministry of Health. And then here, for research articles, there's no way out. You will always require ethics approval. For case reports, sometimes the ethics board might say that, okay, your case does not involve anything, you can give you a waiver. But for both, either you will have to get an approval letter or waiver letter. Waiver bot just the bot saying that it's waived off in email will not work, because you'll have to get a letter from the always good to get a letter on a letterhead from the ethics bot saying that it is waived off, because sometimes some journals would want the letter from the ethics bot and then submit to journal. It's very easy. Now, if see in these two, research article will involve a lot of steps. For your case reports, it involves some little step, but what are the easy low-hanging fruits? See here, commentary. How do you write a commentary? You just sit on your desk, you do literature review, write your manuscript, submit to journal. Here you are citing information from newspapers or already published articles. You don't have to get any permission from anywhere. But the reason is whatever information that you are writing or putting in the commentary is based on whatever is publicly available. So therefore, it's a very shortcut. Now, these are low-hanging fruits. You can write about any topic of relevance and then get it published. To do systematic review, it's also a desk job where you will have to develop protocol, form a team, and then it's more like doing a research article. But here, you don't have to go around waiting for research and approvals. Okay. Now, coming to the very end, taking first steps in research. Work by timeline. So make a timeline for yourself. Okay, by this is June, by July, I'll fix my topic. By August, I'll do this, do that. If you don't work by timeline, you will reach nowhere. Why? Because I have given this same bachelor session many times, and then very few research articles come up. And you should commit to yourself. You don't have to commit to anybody else. You commit yourself that you will deliver one paper to yourself. So deliver it to yourself. Work in teams. Working in teams helps you divide the work. For example, I showed you the example of case report, the earlier one. For me to write the radiological description, it will take a lot of time because I'll have to think, I'll have to cross-check whether it's very correct. But then you involve the radiologist. Radiologists will write that part, and then everything is done for you. So sometimes working in teams makes it very easy. But if you want to be the first author, or if you are the first author, it means that you are driving the car. No? You are sitting on the driver's seat. And then you need the driver's seat, not only it's you, but then if you expect somebody else to drive your car, this will never happen. Which means you are the first author, and if you expect somebody else to write it for you, sometimes what happens is when you work in groups, you will just write the introduction and then you will give big sections to be written by your friends. This will never happen because see, your friend is not the first author, and why should he really invest a lot of time in writing your paper? See, but if you have written everything from first to last, and then you give it to your friend, then it will become very easy for him to add onto or delete or put extra perspective. So this is what I mean by working in teams. So you take the lead, but don't expect others to work for you. And in the initial few papers, I would recommend you to find a mentor, because somebody who has done research, who knows how to do, because it will make it very easy for you, and you can solve a lot of problems. Because otherwise, you will have to go to Google or you watch so many YouTube videos for you to find to a conclusion. But then if you just have a mentor, you ask the mentor, and then mentor will give you a question. You very specific. You will be able to answer your specific questions or specific needs. And you should network with like-minded. If somebody is interested in research, somebody is writing somebody is writing a case report, no, you join with them. So this means that it will help you. For example, if your friend is writing a case report and he becomes the first author for that, but then you contribute by giving comment or doing edits or making the diagram, or you contribute to the paper. So you become the second author or some middle author, and then in the next paper you take the lead, and then your friend becomes a author. So this means that in a very short span of time you will be able to get two papers in your name. Now if you think that, oh, I'll be do everything, and then for every project I'll be the one who will be doing all the work, you will never be able to get two papers in your name. It will take a lot of time. So always divide, whenever it is your responsibility to lead, you lead. Whenever it's your responsibility as a co-author, if your if your friend is sending a paper to you and asking for you to review or make a comment or send your CV, no, why do you have to take a lot of time? No, do it. That's how much, and you can see it. If you receive a paper now for you to comment, maybe in 1 or 2 days you reply to them saying that okay, it is okay, or you add to it. Because if if you hold the paper in your desk and if you hold time, the process will take a lot of time. So my final message is you can do it.